Now, for those of you looking at your Medicare coverage right now, now is the time to make decisions for next year. Our Sharon Epperson joins us tonight with what you need to know for this Medicare open enrollment period and how you can save some money. Now, you've reported in the past that the average couple retiring this year is expected to pay about $285,000 in health care related costs over the time of their retirement, even if you do qualify for Medicare. So what determines how much you're going to spend here? Really, what determines how much you spend on health care is how healthy you are. I mean, it seems to make sense, but if you have a chronic illness, if you have multiple prescriptions that you must take, this is going to increase the amount you spend. So now is the time to really figure out how much you may have to spend in retirement if you're not already retired. And if you are retired, what's changed? How has your health status changed from last year? That may indicate that you may want to make a different choice for your Medicare plan. And then also, depending on how old you are, if you're not 65, as was pointed out, you're going to have to pay for this with a health insurance plan of your own. So you need to figure that out. And your retirement income, the higher it is, the higher the premiums. Keep that in mind for original Medicare in particular.
As we mentioned, this is open enrollment time where you can make changes in your coverage and maybe your prescription drug plan as well. But what are the different Medicare options that are out there at this point? So this alphabet soup is what confuses people because there's so many different parts to Medicare. So we'll start with the hospital visits. That is Part A, and that is free from the government in the original Medicare. Part B is outpatient visits. You may have a monthly premium, and you will for that. And then Medicare Advantage, as Bertha described, is a managed care plan. And so there are various ones from private insurers that you can compare on Medicare.gov to see which is best for you. Part D is for prescription drugs. And that, again, is what you really need to be looking at now during open enrollment to see if there have been any changes and if you can lower the premiums that you're paying for that coverage. If you need some type of supplemental insurance, a Medigap policy can help there. But many people are saying, rather than do that, let me see if I can look at Medicare Advantage. Quickly, I don't know if there's an answer to this, but I mean, between the copays and the premiums and out-of-pocket expenses, how do you try and lower your own costs? Well, do some of the things you were doing in your insurance plan. Look at that network, make sure it's in network if you're doing this Medicare Advantage plan. Also, think now about contributing to an HSA. Pre-tax money goes in, you can use it for health care expenses that may not be covered by Medicare. So that's something to consider. If your spouse is not yet retired, you are, they can put the money in the HSA for you. Sharon Epperson, always good to see you. Thank you.